So this is an example run through of the informed consent process that you'll be delivering to the patient as yourself, the student doctor. Start from the beginning. You were invited to participate in an 8-week research study being conducted by Kansas City University in collaboration with the Ozark Center's New Direction-Based Opioid Treatment Center, OBOT for short. The primary investigator is going to be Dr. Jeff Staudinger. So the purpose of the study, what we're trying to do is take the treatment that you're currently getting at the OBOT program, which includes the Suboxone in addition to counseling, and we're going to add something called osteopathic manipulative treatment, OMT, hands-on care with a scientific basis to it. And we're going to be doing that in addition to these educational modules, simple 3 to 12-minute videos that we'll be having you watch weekly, in addition to what you're already getting. The purpose of these studies is to see if we can help you alleviate some of the current adverse effects that you're having to Suboxone and any opioid cravings that you're currently having. How we're going to be doing this is we're going to just be asking to collect saliva samples from you, just in your mouth, and we'll do that at the beginning of the study and then at the end of the study. And this is going to be over a period of 8 weeks. So week 1 and then at week 8. In addition, we're going to have you filling out questionnaires and scales. This will be on a week-to-week basis. So every time you come in for your educational modules and for your OMT, we'll also have you fill out those scales. And there's going to be a total of 4 to 5 of those that we'll be detailing later in this consent video. To summarize, some important information for you I think you should know and hear. The information that is gathered from these sociological questionnaires and surveys and biological measurements, salivary cortisol, is kept strictly confidential, okay? And only the principal investigator is going to have access to this data, okay? Point being, we're going to keep everything private. Second, you will be given a patient number. And this is the only piece of information that's linking you to the data. So for example, when we get those saliva measurements from you later on, it's only going to have your number. Nothing that we do is going to involve your name. And then third, you will be using the de-identified patient number and given a laminated card for visits to the OBOT clinic to receive treatment in the beginning of the study. And then lastly, we're going to keep close track of this number in the card. Again, this card is you for the purpose of the study. Last thing I want to summarize here, our overall goal and purpose of the study is to provide solid scientific foundational evidence of the utility of that OMT that I was talking about and help out with some of the problems that your community is facing in the 4-state area. So, what is osteopathic manipulative treatment, or OMT? I think it can be summarized in a couple sentences to your guys' benefit. So OMT, it's similar to a therapeutic massage, except in that it's performed by clinicians who have a very deep and well-trained knowledge of the body's muscles, connective tissue, and nervous system. These are board-certified doctors who are performing this treatment on you. And the OMT practitioners in the study will move and stretch your guys' muscles and joints in a scientifically informed and likely therapeutic manner. The length of this study is going to be 8 weeks, and there's 6 potential cohorts, and we're willing to work on you on which time best fits your needs. These cohorts are going to run anywhere between September of 2021 to August of 2022 in groups of 20. So the study design, it's most important that I emphasize for you, you're all going to keep getting the same care you have been at the OBOT program, which includes the Suboxone, includes the counseling. Your standard treatment is not going to change throughout this process. That being said, there's 5 groups. And so for a grand total of 20 of you, 4 of you will be put into each one of these sections. It includes a control group, which is again just the standard of care you have been getting the entire time. The second group includes the OMT that I just talked about, as well as educational modules. The third and fourth group are only going to get OMT and only going to get the educational modules respectively, in addition to the care that you've been continuing to get at the OBOT clinic. Then lastly, the fifth group is going to get what we call sham OMT, which is that therapeutic massage technique I talked about, but by an untrained clinician. So next I'd like to talk to you about scheduling these treatment modalities. You have two options. You can either use the scaling and do the treatments at your regularly scheduled visits at the OBOT clinic at your convenience, or we have options so that you can get the stuff scheduled after hours as well. The next thing I'd like to talk to you about is the SALIVETTE sample return. SALIVETTE being a fancy word for the tube that we'll be using to collect your saliva for that cortisol I was talking about earlier. But I'm going to do a quick run through on the more important aspects for you today. With the SALIVETTE return process, and you'll be getting it at week 1, at week 7, in the beginning and then at the end of the study. Important things to emphasize here is that once you do the SALIVETTE collecting, it needs to be immediately stored in your freezer. We can't have it sitting out over time. Just put it straight in your freezer, and then later on the following week, so for example, week 1, you get the SALIVETTE bag, you collect it at home sometime, then at week 2, when you bring it back, after you take it out of your freezer, immediately return it to your regular scheduled visit, okay? Or there's a drop-off option that's going to be discussed in more detail week 1 during this video process. A couple things that I really want to emphasize to you about the SALIVETTE process is that this is all going to be done using your de-identified number. Privacy is a priority to us, a major one. And all the SALIVETTEs, it's all going to be using your de-identified number. There's no reference to your actual name or personal information. And these SALIVETTEs, once they go to the clinic, it's going to be stored in lock and key in a freezer on site. A couple more points on the actual OMT process that I think are very important for you to know is we understand that COVID is an issue right now, a major one, and we want to be able to accommodate you the best we can. And again, safety and privacy being major concerns. We will have personal protective equipment on hand for the clinician that is going to be doing the OMT on you, as well as yourself, the patient. And last point on OMT is that we have a standardized, which just means a strict protocol we're going to be using of 4 techniques, 4 maneuvers we'll be using, okay? And we cannot stray from that and do any personalized treatment. So for example, if you messed up your shoulder the day before, you can't have the OMT clinician do treatment on that specifically because there's no shoulder techniques within our protocol. So I just want to emphasize what's going to actually happen at the end of the 8 weeks. When your participation in the study ends, you will no longer have access to the study research staff. So the OMT and the educational modules that you are receiving, that ends as well. But any treatment you're receiving prior to the study will be available per normal schedule. So your usual Suboxone and counseling that you've been receiving beforehand is still going to continue same as at the end of this study. It's just the stuff that we're adding that will cease to continue. Okay. Now I want to talk a little bit about any risks that could occur throughout the study. The first one is any physical risks. OMT, there is the possibility of muscle soreness after the treatment. And I just want to emphasize that if you have any such concerns or any side effects secondary to OMT, you can contact your study doctor. The number that we will have you contact is here, right in the middle, and it's that 417 number. If you have any concerns that you might have been harmed throughout the OMT process, I want to emphasize that neither KCU nor the study doctors will pay for this medical treatment, and you will not receive any other kind of payment secondary to any injury that you might receive throughout this process. And this is very, very important. I want to emphasize this very clearly and concisely for you. You may terminate your involvement in the study at any time. You can do it, but also if we feel that you're either physically or psychologically incapable of continuing with the study, Dr. Staudinger or Dr. Ashraf can also cancel your involvement in the study at any time, okay? So that goes for both sides, both parties. Okay. So next is psychological risk. And I just really want to re-emphasize some points already made because safety is a priority to us. During the watching of the educational modules, if you're doing it in person at the Ozark Center, you will have a peer specialist on hand for any concerns that you might have. In addition, we will be providing licensed therapists if there's any sort of psychological harm secondary to the videos that you'll be watching. And then if you proceed to do the telemedicine option, where you're watching the videos from home, we will have the crisis hotline number provided to you. All this already re-emphasized prior, but I just want to make sure that we fully understand it. Economic risks, that's just solely for you to get to the Ozark Center. So just like whatever your means was of getting to the Ozark Center before, any costs that occurred due to that, they're going to continue with this. But that also applies to if you decide to do the OMT after hours. Whatever cost it took you to get there, that is going to be incurred by you. Next is compensation. So you're going to receive money through a Walmart gift card in 2 different time periods. So at week 4, so when you go in to do your forms and get your Suboxone treatment or in your OMT or whatever it is based off what group you're in, you're going to receive a $50 gift card at that time. And then at the end of the study, at week 8, you'll also receive the gift card. So week 4 in the middle of the study and week 8. 50 and 50 for a grand total of $100. One thing it's important to emphasize is if you have to drop out prior to week 4, so for example something comes up week 2 and you get too busy and you can't continue with the study, you will not be compensated. As for possible benefits for taking part in the study, if the OMT and the educational modules do help folks with opioid use disorder, as we theorize they should, you're also going to get the benefit of that directly if you're in the experimental group. In addition, by participating, you will be helping the community deal with the sort of side effects that you guys are incurring, the folks that aren't participating in the study. Everything I'm about to talk about we have already hit before. Any and all treatment that you were receiving at the Ozark Center prior to enrollment in the study, you're going to continue to get. So this includes talk therapies, behavioral therapies, or any medications that your physician made available to you, okay? Or any access to any therapist. In addition, again, your participation, voluntary. You have the option to drop out at any time. In addition, Dr. Staudinger and Dr. Ashraf have the ability to drop you out of the study at any time. And last point here, I just want to open up the floor to you if you have any final questions or concerns, okay? And any major points that we just want to reiterate, they're in these final 3 paragraphs, okay? Here on page 9, all right? So the floor is yours, and thank you for your time. I hope to see you on the other end of the study. Thank you.